times. We used to think they couldn't have a Georgia football game unless we were there.
One of 250,000 University of Georgia alumni, Howard Young knows how to throw a tailgate.
We have some great times.
The third generation of Youngs to go into the family business, Howard is one of 700,000 people operating small businesses in Georgia.
Hey, Lister, I think that's going to be a great program, and I appreciate that.
But of those numbers, none defined Howard as much as 1 in 30,300. That's the number of Americans diagnosed with pancreatic cancer in 2002. He had no symptoms, no warning signs, no risk factors.
I didn't fall into any of the risk profile groups that there are for pancreatic cancer, and those are smokers, people that work around chemicals, or people that are overweight, and generally people in their 70s, and I really didn't fall in any of those categories.
But Howard Young would be different. His cancer came at a turning point for Dr. George Danico, a surgical oncologist with St. Joseph's Hospital of Atlanta. He'd begun working with researchers at Georgia Institute of Technology to create a mapping program to identify the specific genes within a tumor which would respond to therapy.
So you can clearly see the cancer patients look different than the normal, but now look at any one patient. I mean, that patient is in this cluster similar to other cancer patients, but is definitely unique.
Researchers could then analyze thousands of points and blueprint how the cancers would react.
If your cell's not going to be susceptible to whatever chemotherapy you're going to get, if the machinery is not going to be affected by it, being one of those people who get treated under one-size-fits-all doesn't do anything.
And that was the motivation for creating the program Triomph, or the Translational Research Initiative in Oncology for Management of Personalized Healthcare. It turned the one-size-fits-all cancer approach into truly personalized treatment.
That's why this molecular profiling program is so important, because it allows the physicians to identify the chemotherapy that will be most effective. And I think that's going to be the difference in making a difference for people, because one size certainly does not fit all.
Using the molecular profile researchers created, Howard responded to treatment.
So what it does is it still keeps in consideration that you have breast cancer, colon cancer, pancreas, but it more says that your individual cancer has these critical points in its machinery, that if we disabled these points, then we would have a chance of shutting these cells down.
You had tests today?
I had 2 tests.
2? My pancreatic cancer happened to have a lot of targets that could be identified. And a lot of these targets are in common with other forms of cancer, which happen to have chemotherapies that are effective in treating that marker.
Finding those markers requires a unique collaboration of researchers and clinicians. It is a partnership rarely found outside of the academic world. It sets St. Joseph's and Georgia Tech apart.
It's about the only relationship that I know of that's like this.
It's the value of sharing expertise and experience from different ends of the medical spectrum.
It's a game changer, and they're doing it here, and they're taking up this effort when a lot of people aren't. So they're truly pioneers and leaders in this field, and it's going to make the difference between life and death for so many people.
The ultimate goal of Triumph is to find a cure for cancer, and in the short term to turn pancreatic, lung, prostate, and colorectal cancers from fatal diagnoses into manageable chronic diseases.
We're not going to sit on the sidelines and wait for another university medical center to do something. I mean, this is our chance to have an impact.